What happens to a man's sexual health when he masturbates after 60? Shocking hook before introduction. Did you know that by age 60, over 50% of men experience erectile difficulties and nearly one-third stop masturbating entirely because they believe it's unnatural or too risky? But what if avoiding self-pleasure after 60 actually harms your health instead of protecting it? Before we dive in, don't forget to like this video, share it with your friends, subscribe to the channel, and drop a comment below. Do you think masturbation after 60 is healthy or harmful? Let's see how many brave men are willing to speak openly about this. Introduction: breaking the silence around men's sexual health after 60. For decades, men over 60 have been told, directly or indirectly, that their sex life is over. Society whispers that aging men should stop desiring, stop touching, and stop exploring their bodies, but science says otherwise. The truth: masturbation after 60 is not only normal, it can be one of the most important tools for maintaining prostate health, emotional balance, and even cardiovascular well-being. I'm not here to sugarcoat or hide behind taboos. We're going to have a raw, fact-based, and practical conversation about how older men can safely practice masturbation, avoid dangerous mistakes, and recognize the red flags that signal when medical help is needed. This is not about fantasy or shame, it's about science, health, and dignity. Call to action before body. Before we break everything down step by step, I want you to do something. Pause for a moment, hit the like button, and share this with a brother, a father, or even a close friend over 50. The silence around male sexual health ends when we start talking. Body: the 3 essential parts of masturbation after 60. We'll break this into 3 key timelines so it's easy to follow. 1. 0-10 years after turning 60, the adjustment phase, learning safe techniques and new approaches. 2. 10-20 years after turning 60, the maintenance phase, avoiding mistakes that can harm your body. 3. 20+ years after 60, the wisdom phase, recognizing red flags and protecting long-term sexual health. Phase 1. The adjustment phase. 5 core principles for safe masturbation after 60. Quick question before we begin. Did you know that regular ejaculation may actually reduce the risk of prostate cancer by 20–30% according to Harvard research? That's one reason why this practice matters more than ever after 60. Let's explore the 5 principles every older man must adopt. 1. Listen to your body's new language. At 65, erections aren't the same as at 25, and that's okay. Blood vessels are stiffer, nerves less sensitive, and testosterone lower. Instead of fighting it, adapt. Example: one of my patients, age 67, was frustrated because he couldn't get an erection as quickly as before. After shifting his mindset, focusing on slower arousal, relaxation, and mindful touch, he reported stronger, longer-lasting erections within a month. Science says stress is the biggest erection killer. By accepting slower responses, you actually encourage healthier erections. 2. Lubrication is non-negotiable. With age, penile skin gets thinner and drier. Without lube, you risk micro-tears, infections, and painful irritation. Practical tip: always use a high-quality, unscented, water-based lubricant. Avoid petroleum jelly or soaps; they disrupt skin balance and can cause infections. Study evidence: a 2016 urology report confirmed that men over 60 who use lubricants report 40% fewer genital injuries during self-pleasure. 3. Create a sanctuary, not a racetrack. Trying to finish quickly creates stress and makes erections weaker. Privacy and calm are essential. Personal insight: many older men live with family, grandchildren, or caregivers. Scheduling private time, locking doors, or creating rituals like dimming lights, soft music makes a big difference. This isn't indulgence, it's healthcare. 4. Focus on the journey, not just the destination. Older men benefit from shifting away from orgasm as the only goal. Exploring sensation and touch keeps blood flow active and nerves responsive, like physical therapy for your penis. Real-life analogy: just as older people stretch daily to keep joints flexible, masturbation is a form of exercise that keeps penile tissues elastic. 5. Use your most powerful sex organ, the brain. Anxiety, shame, or guilt will destroy arousal. Instead, focus on mindfulness and positive self-acceptance. Scientific fact: a 2021 review found that men who practice mindfulness during masturbation reported lower rates of erectile dysfunction and higher satisfaction compared to those who rushed with performance anxiety. Phase 2, the maintenance phase, 70-80 years old. 5 common mistakes that can harm you. But here's a question: are you accidentally damaging your penis without even knowing it? Let's look at the 5 most dangerous mistakes men make after 70. Mistake 1: the death grip. Decades of using a very tight grip train the penis to only respond to extreme pressure. This causes delayed ejaculation and disappointment with partner sex. Fix: practice lighter strokes, use lubrication, and retrain your nerves. Think of it like breaking a bad habit. Slow, steady changes matter. Mistake 2: ignoring basic hygiene. At older age, immune defenses are weaker. Skipping hygiene increases risk of infections like balanitis or UTIs. Rule: wash hands and penis before and after. Think of it as brushing your teeth, non-negotiable. Mistake 3: forcing an erection. A semi-erect penis is fragile. Forcing it can cause vascular tears and Peyronie's disease, painful curvature. Science: Johns Hopkins research shows penile trauma is a major risk factor for Peyronie's, which affects up to 10% of men over 60. Mistake 4: unsafe tools and lubes. Household items, soaps, or petroleum jelly are dangerous. Only use medically safe sex toys and water-based lubes. Case example: a 72-year-old man used body lotion as lube, developed chronic dermatitis, and required weeks of treatment. Mistake 5: viewing it with shame. This is the most dangerous mistake. Shame makes men rush, avoid lubrication, and ignore warning signs. Reminder: masturbation after 60 is medically beneficial. It boosts mood, reduces stress hormones, and improves sleep quality. Phase 3: the wisdom phase, 80+ years old. 5 red flags that demand medical attention. Shocking stat: did you know erectile dysfunction in older men can sometimes be the first sign of heart disease? These are red flags you must never ignore. 1. Persistent pain. Not mild chafing, deep, ongoing pain. May indicate infection, inflammation, or Peyronie's disease. 2. Blood in semen or urine. Always see a doctor. Causes are often minor, but it could be an early sign of prostate or urinary tract issues. 3. Major changes in erection. Sudden erectile dysfunction or painful new curvature can signal vascular disease or Peyronie. Treat early for best outcomes. 4. New lumps, bumps, or sores. Do self-exams. Any unexplained growth could be an STI or rarely cancer. Practical advice: a quick monthly mirror check takes less than 2 minutes but could save your life. 5. Sudden drop in libido. Gradual decline is normal, but a sudden crash that can indicate low testosterone, thyroid problems, or even depression. All treatable if you act early. Call to action before conclusion. Before we wrap up, take 2 seconds to hit the like button, subscribe, and drop your thoughts in the comments. Do you think men should talk more openly about masturbation after 60 or keep it private? Let's hear your voice. Conclusion: your sexuality has no expiration date. We've covered a lot. Phase 1, 60-70, adapt with wisdom, listen to your body, use lubrication, and embrace the journey. Phase 2, 70-80, avoid the common mistakes: death grip, poor hygiene, unsafe practices, and especially shame. Phase 3, 80+, stay vigilant, watch for pain, blood, erectile changes, lumps, or sudden libido loss. Here's the bottom line. Your sexuality doesn't end with age, it evolves. Masturbation after 60 is not a guilty pleasure but a form of preventive healthcare. By practicing safely, avoiding mistakes, and recognizing warning signs, you're not just preserving pleasure, you're protecting your long-term health, dignity, and vitality. So the next time someone tells you that sex or self-pleasure ends after 60, remember, science disagrees, your body disagrees, and your health depends on it. Final call to action. If today's conversation opened your eyes, smash that like button, subscribe for more frank talks about men's health, and share this with a friend who needs to hear it. And don't forget, drop a comment. Do you think masturbation after 60 is an essential part of healthy aging? Because the truth is simple, your health, your body, your choice.